thank you. Dave Jacobs is the chief scientist at the National Center for Healthy Housing in Washington, D.C., and also an adjunct associate professor at the University of Illinois at Chicago School of Public Health. Among many accomplishments, Dave was also the principal author of the President's Task Force report on childhood lead poisoning in 2000 and has stayed extremely active on this issue. So thank you.
Thank you, Anita. And first, I just want to give a special shout out to Anita and all the folks at Loyola. They keep doing this stuff on a shoestring budget, and if it wasn't for these folks, we wouldn't be here talking about it. I have a decidedly different perspective than what you've heard this morning. I think we need to focus on, well, what are the lessons of Flint? And I think it's a wake-up call, right? What we are doing, if you take home nothing else, it's this message. Our medical model, despite the heroics of our doctors and so forth, is not working. It's not adequate. We can't just be using our kids as detectors. We have better ways to detect lead. We should use them. We have an army of lead inspectors. We should use them. I haven't presented this particular call to action anywhere in the country yet. So this is the beginning of a conversation, but it's my humble attempt to figure out, well, what do the lessons of Flint mean for the nation, and what should we do next? And how do we use it locally? So I'm going to cover some good news, some bad news. My basic three-point framework is we got to find the lead, not just wait for kids to get an elevated blood lead, but figure out where it is, fix it. We know how to fix it. And then nothing happens without money in this world, right? So we've got to figure out how it's going to be funded properly. So the good news is, there's just two bullets here. We know how to stop lead poisoning by preventing exposures, both in the near term and in the long term. The technology is there. This is not a science gap. Among my other hats, I'm also the director of the World Health Organization Collaborating Center on Healthy Housing in Washington, D.C., and WHO has concluded that lead poisoning prevention is even more cost-effective than vaccines. And in the public health world, vaccines are the gold standard, right? So it's an investment that we should make. It's stupid not to do so. Why did our blood leads go down? You've seen lots of graphs today about the declining blood lead levels. It's simply this. The nation took action. We did a lot of things. We put a lot of policies in place, going back to '71, when we had the original Lead Paint Poisoning Prevention Act. We took action to eliminate, to reduce air lead levels and reduce workplace standards back in '78. And I'm not going to have time to go through all these, but the important message is that when you take action, good things happen. When I ran the lead office at HUD a number of years ago, I probably had the only biomarker as a measure of success of the housing program. So blood leads go down. So a lot of policymakers, and I used to brief people on the Hill, looking at this line, they'd look at this line, the red line here, blood lead levels, and say, oh, great, you're done, aren't you? And you've heard this today, right? Oh, lead's been a big success story, so you're done. Well, let me give you another perspective, some bad news, if you will. Well, lead paint's old, we know it's still here. I know this is a little busy, but this is Russ Fliegel's study from several decades ago. And he asked the question, where was the blood lead level among our ancestors, our prehistoric humans? And what he did was, well, it's a longer story, but he basically measured lead in rats, in their blood, measured lead in their bones, and then he found some prehistoric human bones and measured the lead in those bones, and then extrapolated what the prehistoric so-called natural background blood lead level would be. And this is what he found. He found 0.016 micrograms per deciliter. Now, Dr. Binns told you what our current average is today. Who remembers? It's around 1, right? So that means that we are 100 times over where our ancestors are. In other words, we are swimming in a sea of lead. We have not conquered this problem. We have a long ways to go. This is a long-term problem, and we have just begun to scratch the surface. So we can't just be saying it's a public health story, it's a success, we've done enough, we can move on. No, we have a long ways to go. So Flint and other cities, I think, are the tip of the iceberg. If you think globally, We know that lead is responsible not just for reduced IQ, but 674,000 premature deaths annually. This is a WHO, or it's another estimate. In the US, we have 500,000 kids. We know that tens of millions of homes have lead pipes and lead paint and other hazards, but we don't know where they are exactly. Instead, we have these models, right? We have zip codes, we have census blocks, we have higher incidence rates. But within each house, we still don't know exactly where it is. And until we do, we're not going to be able to focus our attention. I'll give you just a quick story. I'm a grandpa now, and when my grandson was born, my son bought a house in Philly, an older house, and I said, well, you're getting a lead risk assessment, aren't you? And he said, no, I don't really think it's important. And he knows what I do, right? So my own son. So I said, well, guess what you're getting for Christmas this year? You're getting a lead risk assessment. And he wasn't happy about it. But what it found was the lead was only in on the back door. And so he was able to say, yeah, I guess I should get rid of the back door. So the medical model has failed. And more importantly, U.S. paint companies and the lead industry continues to make new lead-based paint around the world. We have reports from 45 countries that new lead paint is being manufactured. So it's bad enough they contaminated our housing stock. They're still doing it in other countries, and it's an outrage. I guess in the interest of time, I'm not going to. There are data from the American Housing Survey. We know that low-income households have higher prevalence rates of lead hazards. Black households also have higher rates. Households receiving government assistance actually have fewer hazards compared to the unassisted housing stock. And the more important message is the highest needs, the greatest lead hazards are in the unassisted low-income housing stock where there's no maintenance standards going on at all. That's where we need to focus our attention. So, first of all, find out where it is. Identify all the pipes. Identify all the residential lead paint and lead dust hazards, not just at the census block level, but in each house. Identify lead-contaminated soil in our yards, playgrounds, and so forth. Then fix it. For homes with high lead levels, you do two things. You provide the filters or bottled water if you have to, but you also do a long-term thing. It's not just Band-Aid time. You have to do long-term and short-term at the same time. And so you replace those lead water pipes. Some jurisdictions have done that. Minneapolis has pretty much done that. So has Madison. In Toronto, when they pave the streets, they replace the pipes. So there are ways to do a long-term strategy. It's the same with houses. You deal with interim controls, you stabilize the paint, you clean up the dust and the bare soil and so forth, but then you also begin a long-term process to ultimately remove the lead paint from the entire U.S. housing stock. We have to stop U.S. paint companies from making new lead-based paint around the world. That's an outrage. And then you have to ensure that children who are poisoned get the special needs and the educational interventions that they need. We have to find ways to increase the number of risk assessments in homes with young children, including HUD-subsidized homes. It makes no sense for taxpayers to be financing homes that poison kids. We should clearly not do that. All at-risk children should have their blood tested at least twice before 2, but screening is not enough. We need to update all the antiquated lead regulations. In your handout, I've given you this no lead sort of platform, and you can see the long list of lead regulations that are outdated. The drinking water rule was done in 1991, right? The HUD rule, which I helped write, was done back in '99. We've learned a lot since then. We know how to improve things, so we should act on that knowledge. There's no national goal. We had a 10-year plan in 2000 that we think, had it been properly funded, would have largely eliminated this problem from the U.S. housing stock. Congress did not fund it. They did increase the funding, but we have no national goal right now. And at the time, I didn't really put much stock in a goal, but if you can create a true national goal and then put some power, some muscle, some advocacy to get those dollars in place, then you can actually do it. I remember more than a few staffers said, you know what, Dave? We like lead. Lead is one of those issues where you can see some light at the end of the tunnel. It's solvable. We can fix it. Tom Frieden, who's the director of CDC, eliminated the nation's only advisory committee in the federal government focused on lead poisoning, the National Advisory Committee on Childhood Lead Poisoning Prevention. This is the group that lowered the blood lead level based on the new science. That group needs to be restored. And then, of course, I'm a researcher. You have to provide for more research. We can do better in terms of both identifying hazards as well as correcting them. And then we have to fund it. There's an election going on, isn't there? And one of the debates is, well, how are we going to finance and fund our infrastructure? Are we going to invest in our people and keep our infrastructure sound, or are we going to continue to let it erode and crumble before our eyes? The Flint situation should never have happened, right? It should have been maintained. It should have been, but it wasn't because somebody, some so-called emergency manager, took it upon himself to save a few bucks, which ended up costing us much more than it ever would have saved. That's a stupid decision. And there has to be some professional oversight to make sure that when a guy like that makes a decision that's not scientifically valid, we stop him. Congress nearly wiped out the CDC lead program. I'm old enough now to remember the 1980s when this was done before. If you don't look for lead in our children, guess what? You won't find it. So we have to keep the surveillance going, and that means restoring the CDC lead program to $35 million, not the $2 million it was at a few years ago, or the $15 million it was there. And the 10-year plan, the minimum level for full funding for HUD, which is where most of the money comes to fix privately owned low-income housing, needs to be at least $230 million a year. And then, the important thing I didn't mention, why doesn't industry pay for this? They made the mess. They put the lead in the pipes and they put the lead in the paint. Why not make them pay? So far, they have been keeping their heads down. Sherwin-Williams and the lead industries has not paid one thin dime to help this. What they have paid for, I'll tell you, is lobbyists to go to Congress to supposedly increase the HUD budget. Why? Because they realize if HUD doesn't pay for it, that means you, the taxpayers, then they might have to pay for it. And in fact, a judge in California ruled just that. He said, guess what? The Lead Industries Association, Sherwin-Williams, they have to contribute to the mess that they created to the tune of $1.1 billion, which would cover about half the houses in California. So we can talk about increasing funding in government, and we should. But let's not let industry off the hook either. They're part of the solution, or we need to make them part of the solution. So this is an ad that came out 100 years ago. I'll close. I know I'm over. It said, will the lead paint still be with you? And because they said lead is durable, right? It's a great paint. Well, sadly, it is still here, right? So I submit to you, it is time to end the Dutch Boys lead party. We're done. Let's hold their feet to the fire, make them accountable, make sure our government does the right thing, and then begin a long-term and a short-term process to eradicate this entirely preventable disease. Okay, thank you. No, wait a minute. And while I can get going on my soapbox here, this was meant to be a discussion. I guess that's what we're going to move to next. But I think these are the questions. These are just my rough ideas on this three-point framework. I don't really know if it's the right one or not. Maybe there's some things that should be taken out or put in. What else should be added? How can Chicagoland actually construct a long-term plan and a funding strategy to really make it work? What are the roles for some of the local entities? And then this last piece is particularly important. My group anchors a group of about, I think it's 100 or 150 groups. But I hope everybody joins the National Safe and Healthy Housing Coalition. We have lobby days on the Hill. We bring in parents of lead-poisoned kids and doctors and others to make sure that Congress members understand that this has a human face. And without that, we're not able to do what we need to do. So I guess we're moving to discussion, right? Thank you.